The following segment is sponsored by Ward MD and Forum Derm Spa. I am here with Dr. Ward and we are talking all things hair restoration. Okay, I have a question for you. I'm feeling my hair is thinning just a little bit. I'm getting older. I'm getting worried about it. But there are so many options now if we feel like we're losing our hair.
There are a ton of options, and I'm glad that you brought up because I mean, we talk about hair loss with men all the time, but if you think about it, it's almost like socially acceptable for men to lose their hair. There's a whole bunch of reasons why it's not.
Sure.
But it's so much more devastating for women. And as a surgeon, hair restoration is one of the best treatments for men and women. It just replaces the hair. Now, somebody like you, you're not a candidate. You don't need a hair restoration procedure.
I may be there in a year or so. I'm feeling like I'm losing it a little bit. But are there options for people who still have hair and want to make it a little thicker?
Yeah, for sure. So there's a whole bunch of options, ranging from like pharmaceutical options like medications, topical.
Okay.
Even, I mean, it seems overly simple, but special shampoos do make a difference. And there are some special treatments like PRP or PRF, where you take some of the blood factors and inject that into the scalp, and that can help stimulate it. But I think it's really important to make sure there's no medical things. It's pretty rare for thyroid or vitamin deficiencies to cause hair loss, but it can happen.
That's a good point.
So I think it's really important that you get evaluated by somebody truly medical. And then as it advances, if you really did need more restoration, then the beauty of surgical hair restoration is that it is like permanent natural hair. It is your hair that grows naturally forever.
Wow, okay, surgical hair restoration. What is that and what does it look like and who's a perfect candidate?
So surgical hair restoration takes advantage of what I think is kind of a little bit of a miracle, and that's the fact that when you transplant the hair follicles from this area here to the area up here where we typically have hair loss, they keep acting like the hair follicles from here. And so it grows forever, and it's your hair. So it's actually more properly called a hair follicle transplant, because we're transplanting the follicle that produces the hair, not the hair itself, so it lasts forever. It's your hair. It truly is your hair. It grows naturally forever.
And you're taking it from where it usually is a little bit thicker back here, putting on top.
Right. So the area that is typically affected by hair loss is the area right here on top. The area here, this kind of like horseshoe area, is totally immune to the loss that comes with hair loss. So it's really a beautiful way to restore hair in a natural way.
What does the surgery actually look like? How long do we need to do surgery? Is it an hour, 2 hours? What are we looking at?
So for probably about 85% of people who do this are men. So I like to tell guys, like, hey, listen, the time that your kids are at school, we can do this procedure. You don't go to sleep. You just get a little sedation with some medication, oral pills. And while your kids are at school, you can get a new head of hair. And it's forever. It lasts forever. It's really a miracle when you think about it.
That is so worth it, Dr. Ward. What does the healing process look like?
So about 1 to 2 weeks of healing. You won't be in terrible pain, but you'll be in a little bit of discomfort. The skin will be a little bit red where we worked on the scalp, and so you may want to wear a hat. After a few days, you can wear a hat to cover it up, but it's really simple.
Then you're going to have real natural hair, which is incredible. There are so many options. You guys are doing a screening too for people who are thinking, this may be me. I may be a good candidate.
So a lot of people don't know if they're a candidate or not. And it's kind of a pain to come in for a consult to say like yes or no. So we're doing a special thing where people can send in a photo of their hair. You got to show us your hair loss so we know exactly what we're looking at. Send in the photo and we will be able to give you an answer, yes or no. Are you a candidate, yes or no? And if you are, we'll give you more info.
That is awesome. You can just send in a picture. There's a QR code on the screen too if you want more information. And should we schedule a consult if we feel like we just want to come in? Is that the best way to take that maybe second step?
Yeah, that's probably the best way to do it.
Okay, perfect. Where can we go for more info, Dr. Ward?
WardMD.com.
Great. Thank you so much for joining us. Great to see you.
Thank you.